I'm Dr. John Selner from the Allergy Respiratory Institute of Colorado. My colleagues and I have prepared this tape to acquaint you with a variety of pathology that can be seen in the vocal cords in an everyday allergy practice. In this particular instance, we're looking at a glottis that appears to have asymmetrical vocal cords. Now, there's a very important point to be made here, and that is that these cords are in fact not asymmetrical, but the positioning of the scope leads one to perceive this. Now, if we rotate the scope so that it's in the very center of the glottic apparatus, you can see that the vocal cords are perfectly symmetrical. So this is an important orientating point. The structures of the glottis in this particular examination are really quite normal. The false vocal cords are slightly prominent. Now, in this particular patient, you see a generous lingular tonsils, and then as you come up over the epiglottis, the false vocal cords are really quite prominent. Now, this could be a case of dysphonia plica ventricularis, where the false vocal cords are very prominent in an effort to protect the airway from material, usually inflammatory material from postnasal drip. But you notice the vocal cords are quite normal. They phonate normally. They adduct normally. And the false vocal cords do not oppose in this phonation. Now, this is a cystic lesion, which could be a sessile polyp. Usually, such cysts are bilateral, and in this case they are, with the left vocal cord lesion being much more prominent than the right. This turned out to be a benign oncocytoma. It's called such because of the eosinophilic cytoplasm that's seen, and this is because the mitochondria actually takes up eosin stain very readily, but it has nothing to do with eosinophils or allergy. Now, here's a very different lesion, which is a good example of so-called Reinke's edema. Now, that's edema of the subepithelial tissue that lines the cords and approximately a centimeter or so above and below the vocal cords. Now, this can be very difficult to differentiate from sessile polyps. It is bilateral here, and what it represents is a subepithelial accumulation of edema. Stripping of the vocal cords is sometimes effective here. It's interesting that in this actual case, this patient is a smoker. And we got this patient to stop smoking. This lesion cleared. It had been present for years. Now, this is a very unusual case. You're looking at the epiglottis, and there's a tremendous amount of edema of the epiglottis itself and the para-arytenoid structures. This is a patient who presented with a story of a peculiar sensation on swelling. The only other lesion was a urticarial prominence on the left jaw. She had never had this sensation in the past, and on the most striking part of this was her lack of dysphagia and dysphonia, and you'll notice that the vocal cords are spared. The vocal cords, the true vocal cords, are not involved at all, and this is due to the alymphatic nature of these vocal cords. Now, this is a critical consideration because in cancer of the vocal cords, if you can pick these up early and they're operated successfully, you have a very good chance of preventing spread. Now, notice the marked edema of that epiglottis. One of the real dangers here is that epiglottis could ball valve through the glottic aperture. The patient could strangle with a fatal outcome. Now, this is senile bowing of the vocal cords, or atrophy of the vocal cord, secondary to loss of elastin in the vocal cord ligament. Now, the left true chord is somewhat retracted, making the left false chord look quite full. However, these false chords are actually really quite normal. Now, this patient has a fair degree of hoarseness, which is caused by the pathology that you're seeing here, and this is not uncommon in older patients. As you can see, the patient can adduct the chords really quite satisfactorily, but still the voice quality is very hoarse. The piriform sinus is quite normal. Now, there's a condition called dysphonia plica ventricularis, where the false vocal cords actually come together with phonation. This is not an example of this, as when this patient phonates on command, you will be able to see that the false vocal cords literally don't come together. You can see the true vocal cords behind these very prominent false vocal cords. They actually represent small laryngoseals with a balloon-like swelling of that tissue. I'm going to show you a very much more exaggerated example of laryngoseals, and this is a truly remarkable case of a gentleman who presented with a story for exercise-induced wheezing, and interestingly enough, seasonal increase in asthma and shortness of breath with exertion, particularly, for instance, when he was trying to play golf. Now, it was most striking to notice these huge balloons which represent remarkable laryngoseal presentation. Now, this man actually had two other laryngoseals which are called internal laryngoseals, which were located out of the view of the scope. The importance of this is that this man, were he to have infection in these spaces, could in fact be asphyxiated by the edema involved. You can see the true vocal cords beyond these laryngoseals. Now, this man was successfully operated with a remarkable improvement in his overall voice quality, and more importantly, virtual cessation of his exercise, shortness of breath. Now, this is a case of panglottitis, where there is inflammation of the entire glottic structure. The arytenoids are red. There's mucus pus that's found near the petiole alongside of the false vocal cords. There are polypoidal changes, which are inflammatory polyps on the vocal cords themselves. The posterior commissure has pooling of mucoid material and redundancy of tissue indicative of chronic inflammation. This is a smoker and a patient that has a chronic bronchitic history, which is essentially secondary to that cigarette smoke chemical irritation. Now, in this particular presentation, the trick is to try to separate edema from vocal cord nodules. This patient first has prominent false vocal cords, as you can see, and then beyond that, the true vocal cords are nodular and edematous. There is a certain amount of Ranke's edema involved here, but notice as the cords are opposed that you can see the edematous quality of the nodular structures that occupy the anterior one-third of that cord. Now, here's an example of a callus again. These lesions are reversible for approximately 6 weeks from the time of their inception. If speech therapy is not effective, however, surgical stripping is going to be indicated. You want to think of nodules as calluses, and polyps are more like blisters. Now I'm going to show you a blister. This is a classical demonstration of a polyp. I think you will be able to differentiate it from the nodule which we were looking at, which we characterized as a callus. Now this is a blister in that it's a post-traumatic swelling. Now I'm going to show you an example of a hemorrhage in the vocal cord. You'll notice that the hemorrhage is located in the right vocal cord at about the level of the vocal process. Now almost always this is due to trauma, and the most common trauma is coughing. Now here's another lesion of the vocal cord, and you'll notice that this looks really quite different. This is a papilloma. Actually, it's a stalk of a rather large papilloma that's been there for quite a long period of time. This patient's lesion actually comes off of the false vocal cord on the left and involves the anterior portion of the true vocal cord. You can pretty well make out a normal right true vocal cord, but the left is obscured. Now, this patient actually had a papilloma which ball valved into the glottic aperture, and this patient attempted to strangle on this on a number of occasions. She finally resolved this problem by literally blowing this polyp off its stalk in an agonal tussive episode. Now here we're looking at a polyp with its origin at the top of the vocal cord. You also will notice there is some polypoidal change with the right vocal cord, and there is some erythema of the petiole immediately proximal to the anterior commissure. It's important to examine all areas of the glottis, including the piriform sinuses, looking for evidence of pathology. Now, you will recall that I previously made a point about the importance of the alymphatic nature of the vocal cords. Now, here's a classic demonstration of this importance, and it's also an example of why any adult with hoarseness of longer than 3 weeks duration should be examined. This is a carcinoma, a so-called T1 carcinoma, which is confined to the cord. The cord itself is still mobile. A so-called T2 carcinoma would involve the false vocal cords. Now, this lesion occupies the middle and the anterior 1/3 of the left true vocal cord, and as we have the patient adduct the cords, you get a real good look at it. Now the rest of the tissue there looks really quite healthy, although there's a little erythema. Now here's a lesion that might confuse the observer. On the left true vocal cord there is a vascular granulomatous structure. Now actually what this is a Teflon graft that has been injected into this vocal cord in order to stabilize it and to give this man better voice quality. The lesion is a granulomatous change that has occurred after several years of this Teflon being in place. He has a hoarse voice, otherwise the larynx is quite normal. Now I'm going to conclude this tape by showing you something that's fairly subtle. I think this is a remarkable demonstration of the optics of the new fibroscopes. In this particular case I'm using the ENFP2. Now this is a classic demonstration of the subglottic structures, the vocal cords, the ventricles. And what you might miss here is that this patient actually has vocal cord nodules. They're extremely subtle. But you notice in the anterior 1/3 of the true membranous vocal cord there is this subtle protrusion. So let's go back to where we began this tape. Notice the asymmetry of the vocal cords here. The only difference is the fibroscope is located in the midline. It would appear that the glottis itself is dislocated. If one rotates the scope slightly, you still notice the asymmetry of the vocal cords. The relationship of the vocal cords to the glottis again suggests dislocation. This man was struck in the neck with a baseball bat as a child. He survived a fracture of the thyroid cartilage. The pathology that we have presented here is only a sampling of the material that is seen in a regular medical practice. We hope that it has demonstrated to you the usefulness of the fiber optic examination in attempting to do a comprehensive evaluation of the hypopharynx.